So if you're a regular listener to the Less Insurance to Business podcast, you know how strongly I feel about having a great membership plan. In fact, it's one of the 6 steps. It's one of the detailed steps that you follow. You have a membership plan so that you can attract people in your community that don't have dental insurance. So if you're a regular listener, you know how I feel about membership plans. But if you're a new listener, you may not know about membership plans. A good way to think about membership plans, think of it as like your a dental version of an Amazon Prime card. Or another way to think about it is think about a Costco membership card for your practice. This is like an affinity type program where we come up with an annual fee that covers the 2 hygiene visits, exams, and x-rays. We come up with an annual fee for that. You get to determine what the fee is. And then we also come up with a savings for any of our membership plan patients on any service in our practice. Come up with a percentage there. I'm going to talk more about the details of that. And this is a great way to roll the red carpet out to people in your community who do not have dental insurance. Remember, Naren, when they don't have dental insurance, they are not going to ask you 2 questions. They're not going to call and ask you if you're in their network, because that would be a silly question. There's no network.
Yes.
And then when you present dentistry to them, they're not going to say, well, doc, is that covered by my insurance? No. They might have other questions related to the treatment, but it's not going to be, is it covered by my insurance? Because they don't have insurance. And both of those questions are great questions to put in the rearview mirror and not get again. And the best way to do that is to create a membership plan and to market it to people in your community who don't have dental insurance, because that'll simply strengthen your practice and further reduce your insurance dependence. So huge fans. When we created a membership plan at my Life Smiles practice, we were one of the very first practices in the country to have a membership plan. And now fast forward 16 years later, and membership plans are still not common in dentistry. They're not common. If you're listening to this podcast, you might have one, but they're not common. And we're on a campaign to kind of change that, because what a great way to take control. First of all, in the membership plan, you set your own fees. So you're not leaving fee setting to a third party, namely the PPO plan, that doesn't care one bit about what kind of practice you have. So you regain control of your practice by being able to set your own fees.